The service users who have accessed the ADHD pathway all at a minimum meet the criteria for SMD due to accessing CGL for substance use support and being under the criminal justice services in the pathway that we work in. Mental health and housing issues have also been common areas of need. In thinking about severe multiple disadvantage and undiagnosed ADHD, we've seen a number of barriers for service users hoping to access diagnostic assessment in community services. Other than lengthy waiting lists for NHS services, we found that accessing the assessments in the community can often be out of reach for people with SMD. At baseline, diagnostic ADHD assessment can be delivered across a recommended 2 hours minimum direct clinical contact time, and that's outlined in those UCAN AQAS guidelines. So this potentially equates to a couple of appointments. Prior to appointments, service users might be asked to complete questionnaires exploring childhood ADHD symptoms and current life functioning. They may need to organise someone who knows them well to share collateral feedback regarding their ADHD symptoms, ideally over their life course. As part of the assessment process, they'll be asked to discuss personal and potentially sensitive information regarding their life history, which, given the relatively narrow timeframes for assessment, would need to be discussed quite intensively, potentially. Service users need to organise themselves to both remember and attend assessment appointments consistently, or there could be a risk of discharge. So if you forget, you're late, you forget to cancel, or don't cancel with good reason repeatedly, this will likely be problematic, understandably. However, this pattern of behaviour is also tied in with ADHD symptoms. There's also considerations around finances to travel to appointments, needing to be mentally and psychologically stable enough to attend, and having enough stability to manage offending behaviour or risks. There's, for some people with SMD, potentially social anxiety to contend with, where just leaving the house is potentially overwhelming, being around other people. There might be communication barriers, such as having no fixed address to send letters to, or in terms of actually stability, quality of life, no mobile phone to coordinate contact. If the service user is able to motivate and organise themselves to complete the screening questionnaires, which will typically be really hard if you have ADHD from a concentration perspective, they need to remember to finish them, then not lose or forget to submit them. For anyone who's experienced relational trauma, there's often an immense fear and mistrust of talking to professionals, or more broadly, talking about emotions. The fear of being in a situation with an imbalanced power dynamic, so working with a healthcare professional, for example, even when this dynamic is managed sensitively and ethically, can very often be overwhelming. Assessment appointments might not be in person, could be offered remotely online, which can be a real barrier to anyone who struggles to communicate and form therapeutic connections, essentially in a video meeting. An additional consideration is that in order to determine a diagnostic outcome, the full range of possible comorbid psychological conditions in addition to or instead of ADHD needs to be considered. Given that having ADHD and another condition, so comorbidity, is the norm rather than the exception, and that people who have experienced more adverse life experiences are more likely to have more complex psychological needs, additional time would be needed to thoroughly consider comorbidity, which would likely need to be added onto the initial 2-hour minimum direct clinical assessment period somehow. So the potential barriers to accessing services are immense, and we haven't even covered them all. That's just an overview, obviously, and likely without reasonable adjustments, actually accessing the services can be really unrealistic in terms of needing an assessment. So this forms the basis for why we've developed an adapted ADHD assessment pathway, and this offers extended timeframes for our service users to help engage in the assessment process.